My name is Narges Horriet, and I'm an aesthetics fellow here at ACPS. I'm really excited to start.
Narges is going to be with me for this month and start her training. So as in training day, the idea is your training begins today. The lights right there.
Do I use the backup one or the specific?
Find the matching battery.
My educational background, I went to college at Azusa Pacific University. I'm from Orange County, California. That's where I was raised and kind of spent most of my younger years in California. I went to the Medical College of Wisconsin in Milwaukee, Wisconsin. And then I matched at the University of Mississippi Medical Center in Jackson, Mississippi, where I've done my integrated plastic surgery residency training. So it's been a long journey, 4 years of undergrad, 2 years of interning, 4 years of medical school, and then 6 years of plastic surgery training.
First time she's ever done a funnel.
I chose to do this additional year to refine my surgical skills, specifically in cosmetic aesthetic surgery. And really, to be a private practice aesthetic surgeon, it takes a lot. It's not just about doing the surgery. You need to learn the business aspect of things. You need to be able to know how to talk to patients, how to manage an office, how to deal with employees. And so coming to ACPS, I think I'm going to get to learn all that. I still vividly remember the first time I came here for my interview. I was just blown away by how beautiful everything was, how clean, efficient, effective. Everyone was friendly. It was one of my first interviews, and I compared everything to this place, and it ended up being top of my list, so was really excited to get the match here. The leadership, first of all, of all the surgeons in terms of how the surgery center and the clinics are run is impeccable. And then on top of that, Dr. Morales has just really made the fellowship first class. He has designed it and oriented it in a way that's very organized, and what you see is what you get, and there's always things being innovated and added. And so the fellowship that I interviewed for 2 years ago, back in 2021, it's not the same fellowship that I'm joining, it's even better. So I think that is really valuable. So for all of you guys who are out there, trying to decide, where do I want to go for fellowship? Who should I apply to? I think you should definitely consider ACPS. It's one, I would say it's #1 in the country. So I initially chose to go into medicine because I really wanted to take care of the whole human. So not just their physical body, but also their spirit and their soul and their just overall well-being. And I didn't know that I wanted to do plastic surgery initially. I chose plastic surgery because, one, I love the artistic aspect of it. I love being able to problem solve and create new solutions for different problems, and also to spend time with patients, just talking to them. So we really get both aspects of things, being in the clinic, talking to patients, and then kind of doing the hard work in the operating room to get the results that they're looking for. So I think that patients would like to choose me, one, because I have a very congenial demeanor. I really enjoy getting to know patients. I think that I have a very keen eye for detail, so I will pick up on the smallest minutia. So things that maybe even patients don't notice. I feel like I'm able to see that and figure out how to best accommodate for those things. And I'm kind of a perfectionist, so like all plastic surgeons, I'm going to work hard to give you the best result. That being said, I'm just fun to hang around with. So I really hope my patients feel like they can relate to me, and that I have a caring nature and that I'm going to take care of them. I can't guarantee everything will always go perfectly, but I can guarantee and promise you that I will be with you every step of the way.